Hey guys, so I've been meaning to post this video about my ICU duty week for a long time now. Here are some skills that I learned in the ICU. Hey guys, grab yourselves a cup of tea because this week I'm going to share the things that I learned at an ICU and just got my tea myself, and I have to go back to the ICU pretty soon, so I'm running a little short of time. But nevertheless, it's a whole different world of diagnosis and management because we have a lot of complicated cases, and it's not like a regular ward or what we regularly learn from the book, because there are complicated cases and the management and the treatment are considering all the multiple diagnoses that each patient have. In this treatment chart, we are looking at a patient who's receiving treatment for CKD, CAD, and also hyperkalemia. So many of the patients in the ICU have concurrent diseases, and we have to treat all of them together. And we have a case of CKD, cardiorenal syndrome with hyperkalemia. We have two post-operative cases, one with PSVT and one with hypotension, and we also have another case of aspiration pneumonitis. So a lot of interesting complicated diagnosis, and this week I'm just going to analyze and share what plan of management and treatment we are giving these respective patients. I'm running a little short of time because I just finished my tea and I have to rush back to the ICU, but nevertheless, this week we have cases with CVA and LRTI together, so that makes it a complicated case in a patient who also has previously known heart diseases. We have a patient with post-operative hypotension, post-operative PSVT, CKD with cardiorenal syndrome with fluid overload and hyperkalemia, and a patient of known case of CVA with aspiration pneumonitis. So lots of complicated, interesting diagnosis, and working in the ICU is all about how to manage these complicated cases where we don't have just one focus, one diagnosis. We have multiple diagnoses and multiple approaches, and it involves multiple specialties. So this x-ray belongs to the patient who had CVA with earlier known heart disease. We have to be able to distinguish normal ECG from pathological ECG. In this, we can see multiple blocks. Guys, the amount of tanning that's happening while walking back from the ICU to the hostel is unbearable, and I got so many mosquito bites. That's whole different story. And I just wanted to give you an update about the ICU patient. So it's been around 1 week in the ICU that I've been posted, and the patients who were initially there have, so as I was saying, the patients that were initially there have now been shifted to ward, which is a good thing, except for the one with CKD. He's undergoing dialysis and blood transfusion in view of severe anemia. And also the other patient who had aspiration pneumonitis with old age, known history of CVA, he is undergoing palliative care. And one of the post-operative cases of total hip replacement has been taken to the OT for wound exploration and removal of drain. Other than that, we have a new patient that's come in with OSA and subacute intestinal obstruction who has been intubated. So most of the other cases have gotten better and been shifted to ward, which is a good thing. And right now we have around 3 patients. Part of our ICU duty is to prepare and give epidural top-up for pain management in post-operative ICU patients. Alright guys, now as you can see, I've been very badly bitten by mosquitoes all over my neck and forehead, almost in a line. Looks so ugly. But nevertheless, I just want to give an update about today's new admission in the ICU. We have a new snake bite patient whom we are observing. We have already given him the anti-snake venom. It was one of the rare events where you get to treat something out of ordinary. So we are keeping a tab on his GCS because we are not sure whether the snake that bit him was neurotoxic or whether it was vascular toxic. And other than that, we have another cerebrovascular accident patient coming into the ICU after lunch, so I have to rush back. I had just come to the room and finished my lunch, and now I'm rushing back. So my ICU week ended with me getting back to the OT, and I was welcomed with a splenic trauma surgery. I hope this video was helpful in orienting you to some of the duties that you might be expected to be doing in an ICU, and wait for the next one.